Turning now to the latest on the monkeypox outbreak, as cases have now reached all 50 states here in the U.S. The CDC reporting at least 7 here in Iowa. The World Health Organization now calling monkeypox a global public health emergency. And they say most of these cases are from those who identify as gay or bisexual. But the experts warn this virus can be spread by direct contact with skin or even through towels and bed sheets.
Monkeypox is a contact virus, and what that means is that transmission happens when someone is infected and symptomatic.
And CDC leaders add they're encouraging anyone who is at high risk to get monkeypox to get vaccinated. And again, this is on all that recommendation is for 0.5 million Americans. Well, CDC leaders add they're encouraging anyone who's at risk to get monkeypox. You should get vaccinated in all of that. And the World Health Organization declaring it again an emergency. But what does this outbreak look like here in Iowa? Local 5's Mary Sugden joins us with what Des Moines health experts want you to know.
Yes, Samantha, as you said, CDC data shows only 7 cases in Iowa as of today. And doctors tell me this disease was first discovered in the U.S. back in the 50s, but the recent uptick in cases forced health leaders to take steps to slow the spread. Now, we took a deeper look into how this disease is transmitted and why doctors say there's no reason for concern.
When it comes to the monkeypox outbreak, doctors say you have no reason to worry.
Yes, it's something that we need to watch out for, but the general public don't need to lose sleep over it.
Out of the more than 331 million Americans, roughly 3,800 cases of monkeypox have been confirmed. Doctors say these early infections are mainly being detected in a certain population.
There has been around 3,800 cases, and 99% of them have been men having sex with men.
This is not a sexually transmitted disease. Doctors say the disease can spread through skin-to-skin contact when a person comes in contact with a rash, scab, or bodily fluids. It can also spread through respiratory droplets, but only during prolonged, close, face-to-face contact. And least common, it can spread through touching items like clothing, linens, or towels that came in direct contact with a rash.
Your skin would somehow have to be compromised for the virus to gain access to your mucous membranes. So a lot would have to happen.
But if this still concerns you, doctors say you can take extra precautions, especially while traveling in areas with high transmission, like New York.
If you go to a hotel, then making sure that the fabrics have been changed.
When it comes to vaccinations, Dr. Shaw says right now those are being administered to people who've come in contact with a confirmed positive case.
So if I'm exposed to someone with proven diagnosis of monkeypox, then between 4 to 14 days, I am able to get the vaccine and take it.
And Dr. Vermeer says for those select few who doctors would deem as high risk for this disease, there is a pre-exposure vaccine. However, he says that's something you discuss with your primary care doctor to determine if you're that right fit. Mary Sugden, Local 5 News. We are Iowa.
Mary, thank you.